The history of exercise science. What is exercise science? Exercise science is the study of numerous aspects of physical activity, exercise, sport, and athletic performance that have the common characteristic of movement and adaptations that occur as a result of physical activity and regular exercise. Historical development. Early influences are Greek scholars such as Hippocrates, Plato, Aristotle, and Socrates exploring physical activity in scientific fashion. During the Enlightenment era, Sir John Floyer described a change in heart rate in response to moderate intensity walking, while London physician James Keel added to previous work on the muscular system by describing various aspects of muscle fiber structure and contraction. 19th century influences. The study of exercise received more attention from physicians because of its important role in the maintenance of good health and from scientists who were interested in how physical exertion and exercise affected the human body. An increased interest in training the human body to improve the chance of success in sports came from sport and athletic competition beginning to popularize in private schools and colleges and through the formation of professional teams. 20th century influences. The formation of specific programs of study in colleges and universities to prepare professional physical education teachers and athletic coaches provided the foundation for the development of exercise science. During the last 25 years of the 20th century, academic departments in colleges and universities developed programs of study and specialization in many of the areas that today constitute exercise science. Exercise physiology. Exercise physiology is the study of functional and physiologic responses that occur during and following physical activity. Some areas of study in exercise physiology are factors controlling substance metabolism, muscle control of glucose uptake, bone metabolism, assessment of energy expenditure and physical activity, and environmental exercise. Early 20th century influences. The establishment in 1891 of the Department of Anatomy, Physiology, and Physical Training within the Lawrence Scientific School at Harvard University. The Harvard Fatigue Lab opened in 1927, which then provided sufficient evidence that exercise physiology had established itself as an academic discipline. Late 20th century influences. The passing of funding for health-related research facilities and educational training programs by the National Institute of Health. In 1997, the establishment of the American Society of Exercise Physiologists rose from the belief in the need for an organization to solely promote exercise physiology as a profession. Clinical exercise physiology is the use of physical activity and exercise to prevent or delay the onset of chronic disease in healthy individuals or provide therapeutic or functional benefits to individuals with disease conditions or physical abilities. Duties and responsibilities are exercise testing and evaluation, pre-testing procedures such as pre-test screening, health history, informed consent, performing the tests such as heart rate, blood pressure, echocardiography, subliminal graded exercise tests, and maximal graded exercise testing, as well as exercise prescriptions. Some early influences are William Hubbardin, who was the first to describe the condition of angina pectoris, also known as chest pain, during physical exertion, and the use of physical activity with patients who experience chest pain. Hubbardin and William Stokes are credited with being the first physicians to recommend the use of physical activity and exercise to promote the recovery from heart disease. Recent influences were in 1958, William F. Miller and Thomas Petty published a series of papers promoting the use of physical activity and exercise for treating individuals with chronic pulmonary disorders, including airway obstruction and emphysema. Athletic training and sports medicine. Athletic training is an area of exercise science that helps with the prevention, treatment, and rehabilitation of injuries to physically active individuals and athletes. Primary responsibility areas include clinical evaluation and diagnosis, immediate and emergency care, treatment and rehab, and healthcare administration. Sports medicine is an umbrella term used to describe all things related to medicine, physical activity, exercise, health promotion, and disease prevention. Early history of athletic training, or when the Greeks had trainers called paedotribes, alites, and gymnastes. Recent history of athletic training. A group of athletic trainers began to envision the development of a professional organization, which became the NADA, also known as the National Athletic Trainers Association. In 1956, the NATA began publication of a journal titled the Journal of National Athletic Trainers Association. In 1969, the NATA Committee on Professional Advancement developed and implemented rules and regulations for the certification of athletic trainers. Early history of sports medicine. In 1741, Nicholas Andrew, a professor of medicine at the University of Paris, published the first edition of Orthopedia. Andrew developed the concept of the splinted tree for practicing orthopedic medicine in children, thereby helping to correct and prevent deformities. Recent history of sports medicine. In 1970s, the birth of modern-day sports medicine occurred. In 1989, there was recognition of sports medicine as a subspecialty by the American Board of Medical Specialties. Exercise and sports nutrition. Sports nutrition is an umbrella of exercise science consisting of clinical nutrition, nutritional biochemistry, community nutrition, food science nutrition, nutritional management, and nutritional counseling. Early history of nutrition. During the 17th and 18th century, physicians and scientists used nutrition interventions as part of experiments on diseased individuals. In 1936, Eugene Dubois coined the term basal metabolic rate and examined the relationship between basal metabolic rate and age, gender, and weight. Exercise and sports psychology. Exercise and sports psychology is an area of study concerned with the behavior, thoughts, and feelings of healthy, disabled, and diseased individuals engaging in physical activity, exercise, sports, and athletic competition. Early historic influences. In 1925, Coleman R. Griffith became the director of the Research and Athletic Laboratory at the University of Illinois. In 1938, Franklin Henry established a graduate program in the psychology of physical activity at the University of California, Berkeley. Throughout the 1940s and 50s, research in the areas of physical activity, exercise, sport, and athletic competition examined personality traits in athletes, emotions, and stress related to youth sport competition, college athletic performances, competition, motor performance, and exercise. Some recent influences are in 1985, the formation of the Association for Applied Sports Psychology was established. In 1991, a key step in the professionalization of exercise and sports psychology occurred when the Association of Applied Sports Psychology began to confer a title, Certified Consultant, on individuals who met specific training criteria. Motor behavior is an umbrella term that includes the disciplines of motor control, motor learning, and motor development. Motor control is the study of understanding mechanisms by the nervous and muscular systems coordinating body movements. Motor learning is the study of the acquisition of basic and advanced movement skills that are used in everyday activities. Motor development is the study of motor performance throughout the lifespan from birth through old age. Some recent influences on motor development are during the late 1960s and early 70s, when there were 4 influential books published by scholars that served to define motor development. Early historic influences on motor control and learning are in the late 18th century. Louis Galvani conducted a series of experiments that resulted in the formation and concept of bioelectricity. Galvani was convinced that certain tissues could generate electricity, which turned into muscle contraction. And the law of effect was formed, which holds that stimuli that produce a pleasant or satisfying effect during a particular situation are likely to occur repeatedly during that situation, which was developed in the late 1920s and significantly impacted motor learning research. Clinical and sports biomechanics. Biomechanics is the study of the human body at rest and in motion using principles and concepts derived from physics, mechanics, and engineering. Studies of biomechanics are types of body motion, mechanical system, joint movement terminology, and qualitative analysis of human movements. Some early historic influences are scholars such as Aristotle and Archimedes were instrumental in writing about walking, running, and movement in water. During the 19th century, the field of biomechanics expanded greatly through several key discoveries such as the development of electromyography, the development of measuring techniques to examine kinematics and kinetics of movement, and the beginning of the use of engineering principles in biomechanical analysis. Some recent historic influences of biomechanics are when Nicholas Bernstein studied the coordination and regulation of movement in both children and adults. Foundations for the use of biomechanics to examine the efficiency and energy costs of human movement, established by Archibald V. Hill in the Harvard Fatigue Lab and by Wallace O. Finn, who published the first cinematographic analysis of sprint running in humans. The International Society of Biomechanics, American Society of Biomechanics, European Society of Biomechanics, and the International Society of Biomechanics in Sports have all been instrumental in promoting biomechanics. Career 1, Physical Therapy. Some required education includes a doctoral degree. Other requirements include state licensure and specialty certification. Job settings include acute care hospital, nursing homes, and outpatient clinics, and the average salary is $82,390. Career 2 is a massage therapist. Required education includes previous studies in broad subjects such as anatomy and physiology. Other requirements include 500 hours from accredited school and membership in a credible professional association such as AMTA. Job settings include physician offices and clinics, hospital and wellness centers, hotels, sporting events, salons, and spas. The average salary is $37,180. Career number 3 is athletic training. The required education is a bachelor's degree. However, soon the minimum degree will be a master's degree, which more than 70% of athletic trainers now hold. Other requirements are the Board of Certification exam, aka the BOC exam. The NADA also offers a variety of educational resources to help athletic trainers stay up to date with the latest clinical teachings and techniques, as well as athletic training educators conferences, which athletic trainers must attend. Job settings include colleges, universities, secondary schools, clinics, hospitals, professional sports, and performing arts events. My plan A. My next 3 to 4 years at Longwood, if I do make it into the exercise science program, I plan to take all of my credits needed to graduate with a degree so that I can go into athletic training for 2 years after if I decide not to do anything in exercise science. My plan B, if I don't make it into the exercise science program, I will try to find a similar major like it and athletic training. Maybe I would like it, but if not, when I graduate, I will take whatever needed courses to get that degree that I want. Thanks for listening and watching.